Ladies and gentlemen, welcome to All About EMS Part 2, three-part mini-series where we talk about all about EMS. This part, we're going to talk about BLS medications listed below. But before we give any medication, we want to get a base side of vital signs. So get to the patient, AVPU, ABCs, base side of vitals, and then you can start thinking about giving any medications. Before we give any medications, you got to make sure the 5 rights: right patient, right medication, right dose, right route, and right effect. Burn those in your memory. Make sure you know that every time you consider or you're giving a medication. Check the expiration date on the medication. Call Medcom if required to do so, but we will get into that. When are you required to call Medcom? And make sure you get that base set of vitals, because some medications you can't give if they have a certain set of vitals. First, we're going to go into epinephrine or epi. Criteria 1, rapidly progressing life-threatening allergic reaction, also known as anaphylaxis, not simply a rash or hives. This is severe respiratory distress, facial or oral edema, and or hypoperfusion. So that big thing we have here is an allergic reaction that causes severe respiratory distress. Additionally, we have the facial or oral edema, so there's swelling in the face, cheeks, throat, anything like that, and or hypoperfusion. This is hypo meaning low, perfusion meaning blood pressure. Administer 1 auto-injector dose into the lateral mid-thigh, so you'll expose the mid-thigh, outside mid-thigh, hold that 90-degree angle into the leg, directly in the leg. Hold it for about 10 seconds, and then make sure that full dose is administered. You can repeat once in 5 minutes if the patient does not improve. A pediatric epi is 0.15 milligrams, or half the dose. Additional criteria is a patient with a history of anaphylaxis. So they have an allergy to bees and they get stung by a bee. And they have a developing respiratory distress. So their breathing is troubled. And or hypoperfusion, low blood pressure again, and or a rash. It's a big thing here, again, history of anaphylaxis with respiratory distress. For patients with these criteria, they have the history of anaphylaxis or just the anaphylaxis, and they're going into anaphylaxis. They have wheezing as well. You can give albuterol. Unit dose via nebulizer up to 3 times. Contact Medcom if you're going to give more than 2 doses of epi or more than 3 doses of albuterol. Nitroglycerin. This is for patients with suspected cardiac chest pain, angina, or anginal equivalent. Angina, A, action-induced chest pain. Anginal equivalent is known as referred pain. Referred pain is pain other than the source of the receptors. In other words, this is for typically your heart attack patients who have shoulder pain or pain in their left side of their neck, or their neck, in their left shoulder maybe. Pain other than the origin of the source. It's your body's telling you like, hey, there's something wrong, but I don't know how to feel it. Maybe your heart receptors have never felt pain before. So this is your body's way of telling you something's wrong. If patient requests, assist with the nitroglycerin, up to 3 doses, 5 minutes apart, given that the systolic blood pressure is above 120. Another mnemonic device, I know some of you heard my sky over dirt. This is sun. Sun sets over the horizon, and then it becomes dusk, or dawn rises over the horizon, and the sun comes up. So S over D. Whatever helps you sleep at night. Administration guidelines. Question patient about last dose and effects. What happened? How did it affect them? Assist patient with administering prescribed dose. Record the time of administration. Time, big thing. Recording that on your PCR. What time you did, how did it affect the patient, what happened, how you gave it. Obviously, everything. Write everything down. Sublingually. Sub meaning under, lingual meaning the tongue. This drug is a vasodilator. Therefore, it opens the blood vessels. Opening the blood vessels is an important thing to realize, because you're like, oh, why do I have to give a patient, why do I have to take the blood pressure? That's so stupid. Because when you open the blood pressure, when you open the blood vessels, you lower the blood pressure. Therefore, it needs to be above 120 so you not make them hypotensive or put them into shock. Medcom considerations. Additional nitroglycerin, 0.4 milligrams or equivalent every 5 minutes. So after those 3 doses, you have to contact Medcom if you want to give any more. Nitroglycerin, so if they are hypotensive, so you give them and they become like less than 90 or or you deem them hypotensive. After nitroglycerin administration, place the patient supine and treat for shock. If no contraindications, the contraindication for being in the supine position is severe pulmonary edema, so fluid in the lungs. When you lie on your back, blood flows to your lungs. Blood kind of pools in your lungs because that's where gravity goes. And then your lungs with the fluid in them causes pain. So you have all that pain from the pressure in the blood rushing to your lungs, and then also the fluid. So it causes some pain and pressure on the patient. Aspirin, ASA, or acetylsalicylic acid. Patient presenting with, same thing, cardiac chest pain, angina or anginal equivalent. This is action-induced chest pain or referred pain. These are chewable tablets. 324 milligrams you will give in 4 81 milligram tablets. You will chew them. The patient will chew them only if they're able to chew. They can't chew, can't give the medication. Contraindications is they've already taken their aspirin. They are allergic to aspirin. They have a history of GI bleeds or current head trauma. This is because aspirin is an anticoagulant. It inhibits the platelets from sticking and clotting. So you're prone to bleed more. You're basically hemophilic. If any concerns, if the patient has received their effective dose, you may give the 324 milligrams. Albuterol sulfate. This is for patients with effective work of breathing with wheezing. Wheezing is big here. When someone's wheezing, think albuterol. Albuterol, think wheezing. The terms go together. Administration guidelines. So 1 vial, these like Kool-Aid man administration plastic tubes. Just twist off the top here. Put it in your albuterol nebulizers. And these new nebulizers, they're basically 1 part. So you take off the bottom, put in the dose, put it in, and then the administration is easy. They just poke up the oxygen and they're ready to go. 8 liters per minute, up to 3 doses if symptoms persist. But I'll teach you guys in person how to use albuterol, the new albuterol nebulizers. So big thing here, put the albuterol in before turning on the oxygen. So make sure you're all set to go, or else the albuterol will mist up and bubble at you and you'll lose some of the medication. Contraindications. So this is MedCom must be considered prior to administration of albuterol if patients have any of these heart conditions: angina, myocardial infarction, so they have a history of this. Heart attacks, they have a history of arrhythmia, which is basically the 2 chambers are pumping efficiently. They're pumping kind of spasmodically. CHF, congested heart failure, is there some congestion or swelling in the heart? And for COVID times, we are supposed to don our N95s, face shields, goggles, gloves, gowns, all these precautions for this aerosol form of medication. This is regardless if the patient is COVID positive or COVID negative. Contact your OIC or crew chief if you have any questions about this. All patients requiring nebulized medication should be delivered in a dose that minimizes it into the environment. So if they have their dose inhaler, have them take that instead of the nebulizer we have. Narcan. Narcan is for patients with suspected opioid overdose with hypoventilations. Hypo meaning low, ventilation meaning breathing, slow, shallow, or ineffective respirations. Do not administer if they have adequate ventilations. Look for those pinpoint pupils. Look for a bottle of pills that is gone. Look for your opioids. Check blood glucose, but we can't do that, so don't worry about it. Administration guidelines. You will give 1 in each nostril. 1 dose, 1 milligram per nostril. It's a 2 milligram intranasal. So put it in the nostril, go to the 1 mark, go to the 0 mark. So you may repeat once in 5 minutes if there is no significant improvement. These are your drugs: opium, heroin, morphine, oxy, methadone, codeine, all those painkillers. Painkiller overdose, go into respiratory depression. Obviously, if they have adequate ventilations, you may not give this medication. You can substitute with your 4 milligram that you get at CVS, naloxone from CVS. So if you have that on you, you can give that. But typically, we're just going to give what we have on the bus. So just a little breakdown. Take off these 2 little plastic caps. screw in this meter dose, put on the mucosal atomizer device, and put in the nostril, go to the 1 mark, go to the 0 mark in 1 milligram in each nostril. Oral glucose is a drug for hypoglycemic patients or patients with low blood pressure, low blood glucose level, low blood glucose, hypoglycemic, or altered mental status due to a low blood glucose. Patient is conscious and is able to swallow without risk of aspiration. So this drug is given orally. This is for people with a blood glucose of less than 60 milligrams per deciliter. So obviously we don't have a blood glucose. So for these patients, we'll probably have Vigilant come with their bus so we can get the full story on what their blood glucose is. Administration guidelines: 1 tube of this sugar toothpaste. You will give the whole tube, or you can give a bottle of orange juice, cranberry juice, and high sugar beverage that they can drink or snack. Just remember, non-diet soda. Contraindications: patient is unconscious or unable to swallow on his or her own. So they can't swallow or can't take this medication orally. Lastly, we have oxygen. This is for patients who cannot maintain an oxygen saturation of less than 94%. So if they have less than 94%, you will give oxygen. And they have signs of dyspnea. Dys meaning difficult, pnea meaning breathing. Is no longer given to just people with rolled ankles or anything like that. So use your good clinical judgment whether to give nasal cannula at 2 to 6 liters per minute. So this is your in the nose, around the ears. This is your lower liters per minute route. And then non-rebreather, 10 to 15. This is a little more if they're having more trouble breathing or they're less saturated in their oxygen. And then for patients who cannot adequately breathe on their own, we will do a bag valve mask at 15 to 25 liters per minute. Patients unable to maintain airway, you will use an OPA or an NPA for these patients. Always recheck vital signs afterwards. Remember, before and after vital signs, and contact MedCom. If MedCom was contacted, write that on your PCR. Also write how you gave the drug, what the patient reacted, vital signs, everything to do with you administering that medication, put it on the PCR. Thank you guys, and I'll see you in part 3.